Hello, and thank you for viewing my presentation. My presentation will be on the positive impact of technology on the distribution of health information for Info 281. I would like to discuss how technology has had a positive impact on the globalization of health information and on information communities seeking health information, despite the barriers that continue to impede progress. Globalization of health information is one of the most beneficial results of the advancements in technology and telecommunications within the past few decades. This has not only influenced the understanding of health information within the healthcare community, but the general public as well. Before the advent of the Internet, the dissemination of health information moved at a much slower pace and was less accessible to those with little to no health education. Collaboration amongst health professionals on an international scale has also greatly improved. With email communication and online video conferences, international collaboration can be completed quickly, and the opportunity for misunderstandings would be reduced. Accessibility to health information has also greatly improved. Health information may be accessed through your computer or your phone very quickly and easily. Additionally, those seeking health resources may do so without fear of social stigma or prejudice, as they may research from their own home. Findability has improved, especially regarding obscure content. This is helpful to the health information community for a variety of reasons, but one example that comes to mind is that of identifying a rare malady and the ability to treat it soon after with the correct medication. Additionally, the Internet has allowed for quick access to digital health resources for healthcare professionals and others seeking health information. Although there remains a gap for those without access to the Internet and therefore health information, this is especially true of the Global South, these gaps are being bridged through continued advancements of technology and the assistance and outreach of libraries and other organizations. Obtaining and researching health information is an ever-present need in our world today. No matter where an individual comes from, it is a human right that they are able to access life-saving information. All individuals should be trained in good information-seeking habits and be able to utilize technology to obtain such information. We can better serve the health information-seeking communities by better understanding the impacts of technology in the distribution of health information. Those living in the global north may be under the impression that health information is available to everyone because of the Internet. This is a grave misconception, as many in the global south have no means of accessing the Internet due to lack of coverage or equipment. Built upon this is another misconception that everyone may access health information because many resources have been digitized. However, should someone of little means have access to the Internet, many health information resources would still be expensive and would remain unattainable. Awareness should be raised about these gaps in the dissemination of health information, and many organizations are already working towards filling these gaps. Another barrier to the successful distribution and equal access of health information is the lack of multilingual materials. Most health information resources are in English or other languages commonly spoken in the global north. There are many issues with this. The health field requires precision, and to misunderstand one small section of a journal or article could prove harmful or even deadly to a patient. The skill level and understanding of the English language or other common global north language would need to be extremely high in order to fully comprehend the medical terminology. Therefore, if multilingual materials are not available, we are excluding a large portion of the world. Mistrust is a barrier to data sharing between the global north and the global south. This can be due to past misconduct, colonial oppression, or past crimes against humanity. Many in the global south also fear parachute research, when northern researchers take all of their research back with them, leaving nothing for those in the south. This is a legitimate concern as there has been a history of such abuse for centuries. Although technology can help facilitate great collaboration, such barriers must still be overcome in order to better our global health and to ensure the safety of all participants of any study. Barriers such as these must be overcome to ensure equality for all in health information access. Data sharing is vital to advancing our global health. Many countries in the global south carry a high burden of disease. The data could not only help improve conditions for them, but on a global scale as well. Illiteracy is a major barrier in the distribution of health information in both the global north and south. Illiterate health information-seeking communities are at a greater risk and are more vulnerable to false information. Additionally, many of these communities in the global south speak in uncommon languages or dialects. And finally, poor information-seeking skills. The Internet has been utilized by many groups, including companies and individuals who may not be experts on the subject matter which they discuss. Such sites present a danger, especially to individuals with no health education. If such information-seeking behaviors are identified, educational materials aimed to prevent such searches may be created. Informing and empowering individuals to identify trustworthy information sources is vital to strengthening health information communities. Additional issues could result from filters which are applied by many browsers and can cause searchers to overlook certain resources. Alright, and we can break barriers with technology. For instance, mobile phones. These are becoming more and more affordable for those in developing countries and can be used to access the Internet. This is probably one of the best means by which to connect isolated communities to health information, even if this community speaks an uncommon language or dialect. This tool may even be used to combat the barrier of illiteracy, as health information may be vocally recorded and distributed. Alright, multilingual publications. Language barriers are a major obstacle to equal access, and with the precision required within the healthcare field, translation tools like Google Translate not quite accurate enough and are unable to interpret some things. Multilingual publications where publishers actually publish their articles in multiple languages is a great step towards breaking this barrier. And as translation tools become more advanced, perhaps we will be able to have greater access to multilingual resources. Alright, and telecommunications. These continue to improve and evolve. This is especially true of quality and coverage. I believe this tool can aid in eliminating the mistrust between the global north and south by helping to build better relationships with consistent communication. And adding on to that is recorded information, which is invaluable in distributing health information, and can give a new perspective on the topic and can help the illiterate health information-seeking communities obtain life-saving information. And finally, online classes to improve information-seeking skills. The sheer volume of information found on the Internet is a danger, especially if it is from an illegitimate source. Many libraries and organizations offer classes to help users identify legitimate sources and usable information. And finally, here are a few examples of organizations and programs that help break barriers. Healthcare Information for All, INASP, Hinari, which is by the World Organization, and Health Phone, which is done in part by Indian Academy of Pediatrics. These amazing organizations and programs help those in need to access digital health journals at little or no cost, improve multilingualism by ensuring that future publications will be published in multiple languages, improve government policies or health policies by integrating evidence-based information, and support researchers in the Global South through online learning programs, collaboration, and mentoring. And these are just a few examples of what these organizations and programs do. In conclusion, technology has greatly enabled the advancements in our global health by enhancing communication between information communities from all over the world. Barriers still exist in the development and growth of our global health, but with the aid of technology, we may also work to resolve these issues. Through humanitarian organizations, more and more countries are able to access and contribute to global health information through technology. Improving access to technology and in turn to digital health information will be key to the continuation of successfully disseminating health information and ensuring equal access for all. Thank you so much for listening. Bye-bye.